Where you live has a very strong impact on the kind of food that you buy. I live in inner urban Melbourne and I'm incredibly lucky. I don't need a car, I can walk everywhere or go by public transport, and I'm very close to the Victoria Market. We also have farmers markets nearby. But if you're low income, you tend these days not to live in inner city Melbourne or inner city. You tend to live out in some of the new developments where in some places we don't even have footpaths anymore, and there mightn't be a shopping centre for miles and you've got to therefore travel. But there may well be takeaways. There's a very big challenge in how we encourage people to move away from the diets that they're currently on to ones that are more healthy. And often it is not only a lack of access but lack of experience in cooking at home.
Because we've prepped everything, I think we've got the wraps ready to go. So if we get started on cooking the stir fry. Djerriwarrh Health Services services the Moorabool Shire as well as the Melton Shire. I'm Shannon McDevitt. I'm one of the dietitians that works here. We provide lots of different health services to people in our community for diabetes or high cholesterol or weight management, and then we do lots of group sessions with people as well.
The worst thing about these sorts of things is you try to find something that's low in sugar, it's high in fat. You try and find something that's low in fat, it's high in sugar. So you're damned if you do and damned if you don't.
So what we say to do, Wayne, is where you can, eat according to that healthy food guide. Because if you're having less packaged food, so if you're having your veggies, if you're having like some grains obviously, if you're having fruit, if you're having some protein like what you're having here, you don't need to do a lot of label reading if you're using a lot of the fresh produce.
It doesn't matter how much you read about cooking, it's the practical that shows you how to do it and how quickly it can be done and without a lot of effort. It's so easy and that makes such a difference.
Have you guys found anything else that's been quite useful from the sessions, or what do you think?
How to dress up plain and boring vegetables and make them more attractive to want to eat.
That's exactly what I want to hear. That's music to my ears.
The health impacts of the food that we eat are huge. Having a diet that is high in processed foods is really the driver of obesity, therefore the driver of diabetes, and of course heart disease and cancer. So many of these conditions are preventable. Things we can do is we can tax sugar-sweetened beverages. We know from Mexico they've increased the price of sugar-sweetened beverages and shown immediately a fall in consumption. We should have different urban planning. Small shopping centres everywhere where people live. And really the education system is so important. It starts with children. Children can have a huge impact on their families. Governments pay for the health burden. They're paying for not taking this type of approach.
I really think that it's actually about trying to enjoy food and listening to our bodies as much as possible and getting back to enjoying cooking.